You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxie Mooney. Welcome back to the show, Health Innovators. On today's episode, I am speaking with Stephen Page, who is the CEO of Heart Health Community, or HHC. Welcome to the show, Stephen.
Thank you, Dr. Roxie. It's a great privilege to be here with you.
It is going to be a very interesting conversation today, so thank you for joining me.
Well, I'm honored to be here.
Yes. I like to start off every episode with having the guest give you a chance to share a little bit about your background and what you've been innovating these days.
So, for 40 years, I built and ran a very large executive search firm. We had offices in London, New York, Washington, and Dallas. And we found CEOs for private equity, venture capital, biggest law firms, biggest consulting firms, biggest technology companies, biggest financial services companies. And I was on a plane every day for about 40 years.
40 years.
Yes, that gets old.
Yeah. I'm
Um,
surprised it didn't get old before 40 years.
Somewhere along the way, I had a glorious male menopause and I started racing open wheel cars and fell in love with the sport and particularly the camaraderie around vintage or historic racing. And I always wanted to build a LinkedIn type community for automotive, motorsports, and collector car enthusiasts. And I had four failed attempts at doing that. I had four bad chief technology officers, two crooks, one incompetent, one ran out of money. And eventually I found my dream chief technology officer. His name is Lewis, and he built the original Match.com platform. He's a world-class technologist.
Yep.
And as fate would have it, I met Dr. Tony Das, who became our chief medical officer, and he convinced us that we didn't need to build an automotive community. We needed to build a heart health community. So 3 years later, we've created a very, very innovative heart health community that engages patients, educates patients, and really drives health equity on a global basis.
So, as a founder and visionary, how I'm going to kind of unpack this idea of going from a race car driver to a health innovator. As you spoke to this doctor and he's sharing with you the vision of heart health means, but you already have a vision of how you're going to change motorsports. What was that like transitioning, and what was kind of the impetus for that? Because that's a big transition, completely two different worlds.
I'm incredibly blessed with many interesting people in my life, probably because of what I did for so long.
Yeah.
And one of them is a physician, a cardiologist in Wichita, Kansas, called Dr. Jody Galisha. And he allowed me to shadow him 30 years ago for a couple of weeks, where I actually saw one of the most productive professionals I've ever been around in my life. And Jody has remained a friend.
Mm.
And he pioneered angioplasty, stent technology. He taught over 1,000 surgeons to do it. And if I'm being very candid here, perhaps I always had a little wanderlust. I wonder if I could have been a good surgeon. I wonder if I could have been a cardiologist. So it always
Yeah.
stuck with me.
Right.
And it's funny how these exposures surface years later, which this did. And
Mm-hmm.
I was sitting there in Wichita having a glass of wine with Dr. Galisha, and I asked him, has anyone ever created a heart health community? I don't even know how the words came out, but they did. And he said, no, but I have a wonderful person for you to meet when you get back to Dallas, which is where I live, and that is Dr. Tony Das. And Dr. Das is the head of digital health innovation for our Baylor Scott and White, the Heart Hospital Plano. He's the CEO of his own business, Connected Cardiovascular Care, and he has performed over 30,000 procedures. And when he heard this story, he said, I have wanted to do this for 10 years.
Mm.
So we formed a relationship, professional relationship, and he
Yeah.
has spent 3 years with us, helping us understand every question that he's ever faced in the course of patient care over a 30-year period. And we've codified that in this platform. So that's how I went from racing cars and executive search to building a heart health community. I'm obviously old. I look ancient. People say I when they ask me, it's, "Oh, I'm 90," and they always say you look very good for 90. Well, I'm not 90. I'm 68, but
That's
I I
right.
don't.
How offensive. They're not arguing with you.
Oh no, they say you look pretty good for 90. Um, to have this opportunity to create a global platform, and this platform translates into 121 languages, and in what I call the fourth quarter of your professional life, it's one
Yeah.
of the greatest privileges of my life. It's a really very exciting time in my professional life.
Um, Obviously, there's a lot of folks, and I think historically, when people reach their mid 60s, if not sooner, they start thinking or taking action and retiring. Um, Historically in droves. And it's interesting, I had another guest on the show a couple of years ago, and we were talking about future trends, and he was talking about how the fastest demographic for entrepreneurship is the baby boomer generation. And obviously, you've been an entrepreneur for a long time, but it seems like your generation is taking advantage of that fourth quarter season more than ever before.
I think if you're lucky enough to be blessed with good health, and it all starts there. If you haven't got good health, the rest of this doesn't matter. But if you're lucky enough to be genetically or just because you've taken care of yourself, which I have not,
Yeah.
if you're lucky enough to be blessed with good health and you've still, you all of this accumulated knowledge can be put to such good use. And
Yeah.
I am luckily the recipient of a really good idea and then some really strong help in terms of shaping how this might serve the public and finding the world class technologists to help make the technical part of the
Mhm.
dream true.
Yeah.
That has been, they're all gifts. They're all gifts.
So let's talk about the business strategy and the business model and the evolution of that. So, if I understand correctly, you started this in November of 2020.
Yes.
Yep. So, not too far from the start of the pandemic, which had to be an interesting ride.
Luckily, that didn't impact us.
Yeah.
We office in a very pleasant building in the middle of Dallas, and we all got vaccinated. We all office together. It was one of those wonderfully collaborative things. We all got sick separately, so we'd stay away and then we'd get well and we'd all come back again. And luckily, none of us got really sick. So we managed to get through the pandemic without too many issues.
Great. Yeah. So kind of walk us through this journey of maybe where you are now in the commercialization process. And, how did you reach some of those earlier milestones of, problem solution fit? And then maybe where are you from a product market fit standpoint?
Those are really good questions. So it took us 3 years to build this platform, and two equivalent organizations, the American Medical Association and the American Heart Association, both spent many years and many millions of dollars trying to build a community platform to engage either their members or volunteers. And like my own experience, I failed 4 times before we got it right. They failed.
Yep.
So getting the platform to actually operate at a LinkedIn quality level was milestone number one, and it took us 3 years to do that. Then we created mobile versions of this. Then Baylor Scott and White, the Heart Hospital Plano, became our alpha customer, and we have gone through all of the things you need to go through to get this to work within a hospital system. And frankly, we're still not there yet, but we're getting much closer. But our breakthrough came with a relationship that we've just signed with one of the largest associations, societies in America, a medical association, and they've asked us to build professional groups for 3,000 of their members. Well, our 5 year growth plan said we're going to get to 2,000 professionals, a couple of hundred hospitals. So this is a company making event. It just occurred. It took us 6 months of selling to get it to yes and a signed document. But we are
6 months
now
is
in.
fast in healthcare.
Uh, I'm impatient, so
Yeah,
this seemed like a very long time,
sure.
and I'm used to getting to yes quicker, but 6 months was the time frame. But now we have a chance to make this nationally and globally relevant, and that is such a hard thing to achieve. But with the partnership, and it's a value exchange with this big society, um, we couldn't ask for a better first mega client. It's helping us achieve 5 years worth of growth objectives in year one, and uh, we're chasing our next relationship. So it's a very exciting time.
So, who are your like target audience, your target buyers, and your users of the platform?
The users are the public, so consumers, and have taken. We've created a relationship with the American College of Cardiology, with which I'm a member, and they have what we perceive to be the most professionally curated information about heart conditions. And they define heart conditions in 40 categories in a platform called cardiosmart.org. And
Okay.
we asked the ACC whether we could, with their permission, take that information and put it in a 2024 type platform and add a lot more to it. So we add QR codes so doctors can share those in diagnosis or discharge notes. We've added videos. We will add podcasts. We will add all sorts of media to these descriptions. And if you go to Dr. Google today and you Google angina or heart failure, you're going to get literally tens or hundreds of millions of search results. We believe the information from the American College of Cardiology is the most credible. And likewise, we're focusing on vascular as well. And vascular is the sort of unsung hero of the cardiology and the vascular world. And we're working with the Society of Vascular Surgery to take their professionally curated content. And when you look at our platform and you look at heart conditions and vascular conditions, those two entities are the sources of that information. And we believe that's the most credible information you can get. And our platform is designed to help patients manage, or a loved one, manage a heart or vascular health journey more effectively. So when you get a diagnosis, you may get 15 or 20 minutes with your doctor. And after the shock of whatever the diagnosis is wears off, you've got hours worth of questions. What is this? How did I get it? Where do I go for a second opinion? Where do I go for all the resources to manage this? And we've created 6,500 sources of professionally curated resources organized in 40 categories. For professionals, this is a marketing hub. 85% of the 23,000 cardiologists in America and the 3,000 vascular specialists, they all work for hospital systems. Hospital systems are still in the 1990s in terms of marketing their most valuable asset. They have a one-page resume. So we create professional groups that look much like LinkedIn groups that allow you to hang a lot more things on your professional group so that you can start to create a community for your patients. And we thought hospitals would embrace this, but legal departments within hospitals are very, very difficult and challenging to deal with. And working with associations and building these groups for their members might be the faster way to gain mass adoption of this platform.
So, is this obviously there's tremendous value going through the associations and driving a physician adoption through that mechanism. If it is just an individual independent physician or maybe even an employee at a hospital, can they still come on the platform and build a community?
Yes. So this is open to all.
Hmm.
And most importantly, this is free to consumers and frontline workers. So we're not charging nurse practitioners or physician assistants or AP specialists to create their group on this platform. This is free. We will charge. And you asked this question: who else would be interested in this platform? Well, payers like United Healthcare or Optum, or think of any of the big payers, any of the big pharmaceutical companies like GlaxoSmithKline, Sanofi, Johnson and Johnson, any of the medical device companies like Boston Scientific or Gore, all of them would be interested in using this platform to reach their target audiences, either the physicians that are prescribing their drugs or the medical device companies where they're selling their equipment to perform heart or vascular procedures. Uh, the world for our services is quite broad from a healthcare business point of view.
So, Stephen, do you envision this, kind of this first phase of the go to market strategy really laser focused on heart and and vascular health, but then maybe moving into other conditions as time goes?
You're very insightful.
Hmm.
As this evolves, it could easily become the global health community. But
Hmm.
heart disease is the number one killer of mankind worldwide.
Yep.
50+% of people will die of heart related disease. So
Yeah.
we thought that was the most important condition, so we started there. Dr. Das happens to be an interventional cardiologist, but he's also a vascular specialist. So we were led by Dr. Das, and he said, you really need to start to think about highlighting vascular. And we were
Hmm.
lucky enough to create this substantial relationship with the Society for Vascular Surgery, which is the vascular equivalent of the American College of Cardiology. But if you look at our platform, we've already anticipated the next 10 disease states that we will be building out. And they are the top 10 known diseases. So liver disease, kidney disease, Alzheimer's, stroke, pulmonary diseases. But if you look at the platform and you look at other disease states, the 10 of them are there.
Okay. Makes sense. And I love the fact that you're laser focused in the beginning instead of trying to be all things to all people as a startup, which is a bad strategy. Right?
We
You
don't
got the
have
big
enough.
vision, but you don't have the resources to tackle the big vision just yet, right?
And I love this analogy. Managing a startup is like a Chinese plate spinner. You as the CEO have got 25 plates you're trying to keep up in the air and spinning on these long sticks. Trying to do all disease states all in the first rollout would be a recipe for failing.
Sure. Yep. 100%. So so you touched on this breakthrough partnership that you just landed recently, which
Yeah.
is super exciting. What are some of the challenges that you have experienced in this journey and how did you overcome them?
Some of the challenges are the natural, not restricted to this industry, and the feedback is we didn't create this. It's not of our making. So you're trying to introduce a foreign body into our organization. And we don't own it, we don't control it, so we don't want it. The
Yeah.
next one would be legal. You're going to create all sorts of liability for us, even though this is definitely, and you can look at all of our terms and conditions, everything else, this is not HIPAA compliant. We do not want patient record notes on this platform. This is a community.
But that
But
is
we've
like the
faced,
go-to for legal and compliance. Like whether there's any PHI or anything even remotely involved, it's just like, oh, we can't do that because of HIPAA. It's just a
but they
go-to.
do allow, so the way we overcame that, they do allow their doctors and their patients to join Facebook or LinkedIn or all of the other social media platforms. And
Yeah,
the third big obstacle is IT. We're busy. We'll get to you in 2 years. Well, mercifully, this is a AWS and Amazon Web Services cloud-based platform that requires no integration with any hospital system.
yeah.
And there's two major hospital systems, Epic for large hospitals and Cerner or Oracle Health or Cerner now for hospitals generally with 250 beds or less.
Hmm.
We actually talked to Epic about integrating with them, And we are talking to Oracle Health about integrating with Cerner to just drop our QR codes into their patient diagnosis or discharge notes.
Mm-hmm.
Epic is such a difficult potential partner because an integration, an API integration, is going to cost between $50 and $100,000 for each hospital. But it is each hospital. Every one of them is different. You do not have one Epic API that fits all Epic systems. You
Sure.
actually have to do a separate interface for every hospital, which is financially not feasible.
Sure.
So we have to pick where we go, and it's a fabulous. No, I would never have understood this before we got into this. You know, how do we actually roll this out? Learning about some of the technical or business obstacles you face when you try to provide a solution to a certain segment of the population. Um, those can be company killer type experiences if you're not prepared or flexible enough to pivot. And we were, I'd like to say we thoughtfully got to where we started trying to solicit associations. But it turns out I think that's our fastest and best path to commercialize this platform and to introduce it to as wide a range of people as possible.
Thanks for sharing that. Um, so, what has your funding journey been like?
The Bank of Page is the first port of call, and then we were lucky enough to find um, six people that put in just over $1 million in what we call a friend and family round.
Mm-hmm.
And we are with the signing of this large company making transaction, we are just about to start a 5 million Series A round. And we will offer potential investors or offer investors the following. They get what's called a participating preferred return. So we intend to ultimately sell this business, and likely buyers are the Amazons of the world, the Googles of the world, the Walmart Healths, the CVSs, etc. Or it could be a large payer, an Optums. There's plenty of people that could benefit from a platform like this. And the investor will get their 5 million back first, and then 20% of whatever we sell the business for after they've received their investment back first. So it's called a participating preferred return. It's about as fair as you can possibly be with the investor. And I would challenge anyone to build the platform that we have with the content we've created commercially for less than $5 million. So they have an insurance policy with the platform itself as a sort
Mm-hmm.
of a first lien on our property. So we are just opening the doors to a Series A investor. If you have any in mind, don't hesitate to connect us.
Okay, sounds good. A couple of people or pathways come to mind for sure.
Fabulous. Thank you.
So, as someone who is in their fourth quarter, who's been outside of healthcare for a long time and run a variety of businesses. I think that like many people that have entered into the healthcare market for a few years, you have a broader perspective because you weren't just in healthcare. So as we kind of think about wrapping up here, for all of the other entrepreneurs that are in our audience that are trying to commercialize their innovation, what are some of the lessons that you've learned over the years that you would want to share?
This is a really good question, and I'm going to go back to what was the prime reason for my professional life, which was very senior level executive search. I helped build leadership teams for a variety of companies for a long period of time. And part of our client base were private equity and venture capital firms. And the first thing they do when they make an investment, 99% of the time, is want to fire the founder. Not always, but nearly always. So we had to go and find someone to run the business as the founder was put on the sideline, or however, whatever that transaction was. Healthcare is harder than anything I've done. Everything, restructuring banks, building, my own professional services firm was child's play compared to trying to create a business in healthcare.
Yeah.
The CEO of a hospital once looked at me with very sad eyes and he said, I am so sorry this is so hard for you, but healthcare is really hard.
Hmm.
Breaking into healthcare is really hard. And my advice for anyone that wants to do it, it is a wide open playing field because healthcare is way behind financial services or technology in terms of marketing expertise. And if you're bringing marketing expertise to healthcare, there will be a place for you. But the two tips I would give are find yourself a subject matter expert that is willing to be a partner. And then, secondly, make sure that what you're building is really needed and will be purchased once you've built it. Don't build something in a vacuum hoping everyone loves it. Spend a lot of time talking to potential buyers and making sure there is a market for what you're building.
Golden. Gold. It's definitely challenging in healthcare, but as you kind of started out with talking about the mission and the purpose, there can be fewer things that are more rewarding than really being able to, serve humankind, and impact, families and communities at scale, in a real, purposeful way than the work that you and many other health innovators are out trying to do.
This is why I spring out of bed every morning. If you live in one of America's 100 big cities, you're going to find your version of Dr. Das that'll help you through this heart or vascular health journey. If you live in one of the 4,000 rural America near one of the rural America hospitals, good luck finding this professionally curated information. And if we take this globally and we now think about China or India, they don't have anything like this. This really does have the
Mhm.
potential to impact mankind. And my favorite saying that I've learned in the course of the last 3.5 years: better educated patients lead to better health outcomes. And every health professional listens to that statement and starts nodding, just like you did. And if we can help bring that professionally curated information to a global basis and help mitigate this 50% mortality rate, because people start to manage their health conditions more effectively because they now have the knowledge on how to do so. That will be the greatest gift I can possibly, or legacy I could possibly ever leave mankind.
Yeah. Yeah, definitely. Well, thank you so much for joining me, Stephen. I appreciate it. Is there anything else that you would want to share before we wrap up?
Dr. Roxie, it has been a privilege talking to you. You're very good at what you do. You asked all the right questions, and I really feel honored to be on your podcast. Thank you very much.
Thank you so much for joining me. So, for those that want to invest, make referrals, or talk to you about the future of HHC, how do they get a hold of you after the show?
The email address is spage, so S and then PAGE at hearthealthcommunity.com. And that's the best way to start a conversation. And I would be delighted to engage with demonstrations or uh, personal meetings at any time, anywhere.
Excellent. Thank you so much for joining me.
Thank you, Dr. Roxie. Bye.
Thank you so much for listening. See you on the next episode of Health Innovators.